50% of people don't take their medicines as intended. This can lead to poor quality of life, unnecessary illness and admission to hospital. In many cases, these effects can be avoided just by taking medicines correctly. This is why new NHS services have been introduced into community pharmacies to help people get the best from their medicines and to stay healthy at home.
Please can I have a word with the pharmacist?
If you've started new medication for a long-term condition, you may be eligible for the new medicine service with your pharmacist. If changes have been made to your medicines in hospital, your pharmacist can help you understand these with a discharge medication review.
Good morning, Mrs. Matthews.
Good morning.
East Lancashire hospitals are the first to introduce refertopharmacy, which allows hospital pharmacists and technicians to refer people directly to their community pharmacist for a new medicine service or a discharge medication review. The hospital pharmacist gains your consent before making a referral. Using mobile technology, all the information your community pharmacist will need is quickly and easily captured at your bedside. When refertopharmacy is informed that you've been discharged from hospital, your discharge letter and referral are sent securely to your community pharmacist. If you wish, refertopharmacy can send you a reminder of your referral by text or email shortly after you leave hospital. Your pharmacist will contact you a few days after you've left hospital to arrange a convenient time to meet to discuss your medication needs.
When I was about to leave hospital, I spoke to the pharmacist and they were helpful too. And they told me about this new scheme, which I think is amazing, because you can actually go along to the pharmacist and you can find out things that you maybe wouldn't have the time to do with the doctor. You can find out why you're taking it and what ill effects it might have. So I'm delighted.
When I'd been in hospital, I was told I'd got COPD. And the pharmacist explained the condition to me. She showed me how to use the inhaler that they'd given me, and she's also helping me give up smoking. She's given me an inhalator, and for the last 7 days I haven't smoked. I'm really pleased.
I was on a long flight home from a family holiday in America and I got a blood clot in my leg. I was put on warfarin for a few months, and my hospital pharmacist ran through the do's and don'ts of what to do, and he even gave me a little yellow book. They also referred me to my local pharmacist, something I'm really glad about, because there was so much going on, it didn't really all sink in. And with my local pharmacist, we managed to run through in great detail about what to do, what medication to take. And because I met her several times, it also gave me the opportunity to ask questions and get really reassuring and correct answers.
Oscar was rushed to hospital when he was struggling to breathe, and he was diagnosed with asthma at hospital. We were told about the new medicine service at the hospital, and when we were home we met with the pharmacist who explained everything to us, showed us how to use an inhaler. It was really great, can't recommend the service enough.
The pharmacist helped me use my spacer.
I went into hospital, my blood sugars were all over the place. So they changed a couple of my tablets and told me about a new medicine service that my pharmacist does. So I went along and Sue, my pharmacist, went through all my tablets with me. And well, I'd only been taking one at the wrong time for years. I can't thank her enough. She also told me about a diabetic support group, local, which I now go to.
मैं अस्पताल में दाखिल हुआ तो डॉक्टर ने मेरा ब्लड प्रेशर कम करने के लिए कुछ नई दवाएं शुरू की। अस्पताल के फार्मासिस्ट ने मुझे पूरी तफसील से बताया कि उन्होंने एक नई मेडिसिन सर्विस शुरू की है जो कि मेरे लिए काफ़ी मददगार साबित हो सकती है। और फिर मेरे कम्युनिटी फार्मासिस्ट ने मुझे पूरी तफसील के साथ बताया कि ये ब्लड प्रेशर कम करने के लिए दवाइयाँ मेरी सेहत के लिए कितना ज़रूरी है।
I went to the doctors just for a checkup and found out I had high blood pressure. And we had a talk about it in the chemist itself. When she told me about the tablets and what they did and which one were which, I had a good idea which they were like, but I didn't know what they did. And she explained this to me, so it was very good of her.
They changed some of the tablets, so it did feel safer knowing that my pharmacy was in touch with the hospital pharmacy. Sometimes I used to forget to take my medication, I was a bit forgetful,
As a GP, I'm very supportive of the new community pharmacy schemes, in particular the new medicine service. I look after a lot of patients with long-term conditions, and they often are taking a large number of medications. I know that if they understand those medications and the reasons for taking them, then we can help them to stay healthy at home.
With the aid of refer-to-pharmacy, the hospital pharmacy team can make sure you always see your community pharmacist at the right time, when you need them most. They will help you get the best from your medicines and help you stay healthy at home.